Hi, Paediatric Squad. Welcome back to the channel. Today we focus on the use of Dupilumab in children with atopic dermatitis or the eczema. So we will go through what it is, who can use it, what are the side effects, how effective it is, and also what are the other indications. So stay tuned. Let's get started. So first of all, when do you need the Dupilumab as a pediatrician? When would you think of, oh, okay, let's try this? What is the time? Okay, is the children with eczema. But I'm not saying those mild eczema. What I'm saying is those with moderate to severe eczema, which is refractory to topical treatment. For example, you have used the emollients, the parents already have adequate use of topical steroid, even you increase the strength, it doesn't work. You need to think of Dupilumab. Is a new drugs or is a good drugs for helping these children? So what exactly is this? So as you can see in the picture, it is an injection. What is that? It is a fully human monoclonal antibody. It's a monoclonal antibody. I will go through a bit later what exactly is that. But then it is for subcutaneous injection every 2 to 4 weeks. Okay, it depends on the age, on their body weight. Okay. So some disclaimer, this is just for educational purpose and sharing. If you do have the eczema, you want to consider Dupilumab, do ask your doctors. Don't trust everything on the YouTube only, okay? Do ask your doctor. So when we talk about Dupilumab is a monoclonal antibody, we need to know what exactly is that, okay? So let's break it down. Mono means single, right? So generally, in the world of the antibody, for example, if you got infected by a bacteria or virus, when your immune response trigger, usually the antibody are not monoclonal, which means it's not only target on one single target. They're usually poly. They target multiple targets over the bacteria. But mono means those antibody only target one single target. They are by design by the human. Therefore, it is very specific. Only one single target. All right, mono means single. Clonal means all the antibodies are identical. So you can imagine it's a drugs by design. When we design the target, we try to design the antibody, and we try to produce many of the antibody. Okay, and all these antibodies have one single target. So this is monoclonal antibody. Okay. So having said that, then what is the target? The target is the IL-4R alpha subunit. It sounds complicated, but don't worry, I will explain. If you have antibody targeting this IL-4R alpha subunit, basically it is shared unit step by the IL-4 and IL-13. So when you block this, you will block both IL-4 and IL-13. Then what is the use of IL-4 and IL-13? It is for the type 2 inflammatory response. So basically, you block IL-4R alpha subunit, you block both IL-4 and IL-13, and then you block type 2 inflammatory response. And eczema or atopic dermatitis is a type of type 2 inflammatory response. It sounds complicated, right? Don't worry, I will try to go through it bit by bit. You will understand by the end of this video. So first of all, we need to understand what are the types of the inflammatory response first. As I said, eczema is type 2. Before we explain type 2, we explain type 1 first, okay? Type 1 inflammatory response means actually it is a very vigorous response, it's a strong response. When you get infected by either the bacteria or the virus, your body will trigger the type 1 inflammatory response to kill the bacteria and virus inside the cells because they tend to invade the human cells, right? The type 1 inflammatory response is to kill them inside the cells. And this will involve, you may have also heard of that, the T helper 1 cells, the cytotoxic T cells. This is the inflammatory response to kill the bacteria and virus. How about type 2? So type 2 is a bit different. Initially, it's for killing the parasites, okay? Because in the old days, we have many parasites in the world, okay? Parasites is much bigger than the bacteria and also the virus. Therefore, when your body got triggered by the parasite, they trigger the type 2 inflammatory response. What do? First of all, they will ask your body to produce more mucus in your airway. Okay, so make you cough in order to cough out the parasite. Or they make you very itchy on the skin. They let you know, oh, your skin become red, your skin become itchy, so that you will scratch it to physically remove the parasite over there. So initially, the intention is good. But nowadays, the hygiene is better. Less and less parasite can invade human. But instead, sometimes the type 2 inflammatory response can be triggered by some allergens. For example, pollens. For example, how dust mite. And therefore, people with strong type 2 inflammatory response can have eczema because of the itchy skin, can have asthma because of you produce more mucus in the airway, or they have allergic rhinitis. Your nose become itchy because initially it's for removing the parasite. The type 2 inflammatory response is the allergy response. So therefore, when a patient has eczema, generally they may also have allergic rhinitis, they may also have asthma, they may also have eczema. It is called atopic march. And during this type 2 inflammatory response, it includes few cytokines, which are the messenger. Okay, so IL-4 and IL-13. They are the messenger to tell your body, okay, it's time to trigger something in order to remove the parasite. And they also involve the T helper cells too. Okay, when we have the Dupilumab, which is an antibody targeting the IL-4 and IL-13, they try to lower down the type 2 inflammatory response so that it can help the eczema. So if you take a look at this diagram, you can see that Dupilumab is anti-IL-4 and IL-13. It can actually decrease the type 2 inflammatory response and also decrease the IgE production. It can improve the skin barrier function. It can decrease the skin inflammation and also decrease the itchiness and also decrease the erythema. And that's why it can help the eczema. So knowing the mechanism, knowing what is that, then how effective is that? So there are 3 classical phase 3 randomized control trials that I would like to mention. First of all, is it proven to be effective from 6 months to 18 years old in terms of the pediatric population? So therefore, theoretically, over 6 months, you can already prescribe the Dupilumab. So this is the first classical trial that published. It's a randomized double-blind placebo-controlled trial, okay? They target for those children with eczema, aged from 6 months to younger than 6 years. So these are the results. So you can see there are 2 scores, IGA 0 to 1. So which means when the investigator try to assess the patient, if the skin is all clear or almost clear, they will score 0 to 1. And therefore, this is the primary endpoint. So if you can have IGA 0 to 1, which means your eczema is very well controlled. So you can see that comparing Dupilumab plus the topical corticosteroid comparing to topical steroid only, you can see that there's a significant difference in terms of achieving the IGA 0 to 1, 24%. And the secondary endpoint is the EASI 75, which means there are 75% of improvement in terms of the eczema assessment. So again, it's good. You can see there's a much difference between using the Dupilumab and the placebo only, 42%. So this is another landmark study, a phase 3 trial for the children from 6 to 11 years old with the eczema. Again, we look at the IGA 0 or 1, EASI 75 score. You can see Dupilumab is the purple and the blue line, and this is the gray line is the placebo. You can see there's a significant difference between the Dupilumab group and the placebo group. It's useful. So how about those greater than 11 years old? So this is the third trial they have done, 12 to 18 years old, for those adolescents with uncontrolled eczema. Again, EASI 75, IGA 0 to 1. So the orange and the blue line are those with Dupilumab, placebo, dark line. So you can see significant difference. So we can say that Dupilumab is quite useful. Of course, you can, when you look at the number, it's not 100%, but then it's effective in around 40% of the patient. So we can try this for children with severe eczema that not responsive to the topical steroid. But the next question is, what are the side effects of Dupilumab? So you need the injection. As I said, you have the subcutaneous injection, right? Every 2 to 4 weeks. So usually they will inject it over the abdomen or the thigh. So one surprising result is that studies find the patients on Dupilumab can have conjunctivitis. In one study, it shows a 2.4-fold comparing to the placebo. Patient can have conjunctivitis. The exact mechanism is still under some discussion, but then seems most studies can find this correlation. Secondly, of course, we need to think about injection site reaction, right? Because you need the needle, you need the injection. Of course, they will have injection site reaction, like erythema, swelling, pain. 1.9-fold comparing to the placebo. And also some patients on Dupilumab can have nasopharyngitis 1.4-fold. We need to counsel parents about that. And some other reported side effect, but then it's not very common. For example, like psoriasis, eosinophilia, arthritis, or some patient can even have the exacerbation of the atopic dermatitis. So we need to counsel the patients of all of these side effects. But then most common will be conjunctivitis, injection site reaction, and the nasopharyngitis. After seeing the side effect, who can receive the Dupilumab? Okay. So from the US FDA and also European Medicine Agency, it's approved for children greater than 6 months old. It's the first and also the only biologics so far that approved for such young patients who are suffering from refractory atopic dermatitis or eczema. When we talk about Dupilumab, it's targeting the IL-4 and IL-13. If you remember, we said that it's type 2 inflammatory response, which is also responsible for like asthma, allergic rhinitis, those sort of things. Can it be used in other indications apart from eczema? The answer is yes. So other indications, actually for those greater than 6 years old, if they have moderate to severe asthma, especially for those oral steroid dependent or eosinophilic phenotype, they can actually use the Dupilumab. But of course, it's not registered in all the places in the world yet. Okay. And secondly, for those who are greater than 1 year old, if they have the eosinophilic esophagitis, they can try to use it. Because again, the type 2 inflammatory response will trigger the eosinophil. So sometimes it can help. That's all my presentation. There are a few key takeaways I want you to remember after watching this video. Dupilumab is a useful drug, can be used in moderate to severe eczema. It's effective from 6 months onwards. Common side effects include local injection reaction, conjunctivitis. It is also useful in those severe asthma and eosinophilic esophagitis. Do remember that this video is just an overview. I just briefly talk about Dupilumab. It's just a start. Do check out the references and there's some suggestion for readings in the description box. I really think that no video or no AI can replace your own reading. So do check out the references there if you're interested. And if you are interested in more video like this about the pediatric topics, or you want to help me build up a pediatric community online to treat our children better, do subscribe to the channel and do subscribe my newsletter in the description. I will send you an email from time to update you about what are the latest study recently. And if I have the video, I will notify you as well. So stay tuned and I'll see you next time. Bye.